Greetings, it's Francesca Arnoldy, Program Director of the End-of-Life Doula Training Program at the University of Vermont and author of Cultivating the Doula Heart, Essentials of Compassionate Care. Today I want to talk about the tenets of doula care as well as the scope of the doula role. So to start, here are the tenets of doula care as described in Cultivating the Doula Heart. Doulas accept that birth, death, and grief are normal, natural, expected parts of life. Doulas provide non-medical, non-judgmental, emotional, spiritual support and soothing comfort measures. Doulas cultivate inner calm and peacefulness. Doulas promote informed consent for each client. Doulas gather relevant information and connect clients to beneficial resources. Doulas assist each client with having personally meaningful experiences, together developing wishes for care and encouraging the preservation of energy for what's most important. Doulas trust in the inherent wisdom of each client to discover their own best path. Doulas companion rather than treat, serve rather than fix. Doulas empower and encourage a client's loved ones to operate within their comfort zones and fill in support gaps as they arise. And doulas promote self-care as vital to preserving and sustaining energy levels and enhancing holistic health. Doulas are non-medical care providers. We provide emotional and spiritual support, not medical care. No direct hands-on medical care. Our training program does not prepare doulas to be able to offer that. And also, we do not administer medications. We do not push patient control buttons, and we do not develop any pain medication schedules. If a doula is concerned that a client is experiencing pain and suffering, then what we need to first start with is contacting our client's loved one, healthcare agent, close network of people. Who is the go-to? If our client is no longer communicative, then this is vital. If our client can communicate distress, then we lift up that voice and we encourage the client to reach out to hospice, to the nurse, to the palliative care nurse, whoever is going to be assisting them with assessing pain at that point. And we encourage loved ones to do so as well. Sometimes a doula will have written permission to directly contact hospice, but it's always best if the client themselves can, or the loved one, healthcare agent, surrogate, and then finally, if not, perhaps the doula could. We always want to think about our clients' preferences and wishes and also fears when we're thinking about next steps and addressing suffering, and also addressing the whole person, the many facets of suffering, including psychological, including past trauma, including social, including independence, increasing dependency, all of those factors as we think about a person suffering at end of life. If a doula is finding that they are becoming triggered by something, perhaps this experience is reminding them of a past experience. Perhaps it's bringing up memories that are really uncomfortable. Perhaps it's bringing up nerves or anxiety. Then that is a cue for the doula to really engage in self-care and also introspection, contemplation, journaling, talking with a confidant outside of the work, so that we don't bring in and overlay our stuff, any agenda, any unresolved issues that we may be carrying ourselves. It's really important that we practice within scope as doulas for the safety of our clients and also for our own safety. Doulas could be at risk of being sued. There could be litigation. And then also to protect this movement at large. Doulas are working really hard to help educate those in their own communities about what it is a doula can offer and all of these wonderful complementary services. We do have people who come through the course that are not intending to practice necessarily as a doula, but who are physicians and nurses' aides and mental health care workers and spiritual care providers, hospice volunteers, and they intend to infuse doula essentials and doula skills and doula approaches into the work that they're offering to those at end of life. We need to be really clear about what hat we're wearing, and we need to be really dedicated to providing best care services and practicing within our professional boundaries.